Well, someone else who does kind of creative things with spinal cords, right?
Not too creative.
Not too creative. Frank Giordano is here, and we're going to be talking about what does a chiropractor do? When do you go to a chiropractor, and is it always advisable? So let's talk about that to kind of frame it up, because people, I think, sometimes know that, oh, I got this, who do I see? Do I get a prescription? What's going on?
Yeah, great question. So to say what is chiropractic, basically chiropractic is a non-surgical, non-drug approach to treating. Non-invasive, conservative kind of approach to treating musculoskeletal disorders. Chiropractic actually, probably from the Greek, maybe Latin, but chiropractic means working with your hands. So
just like an artist does.
Just
See,
like an artist, a little bit like that.
Right up there.
I'm not creative either,
No.
so that way. So the manipulation, I think, the spinal adjustment is what I think we're most known for, and that's basically a maneuver that kind of mobilizes the joints.
So first of all, you have to kind of assess what the problem is. And you get that from the patient. They'll tell you, I got this pain over here, and I'm not sure. Is it an organ, or what is it, So, because sometimes it manifests itself differently.
Absolutely. So, you're right. You can have a pain in your shoulder it could be from gallbladder. It could be from, so there's diagnosis, very important. And that's one of the factors in school. We learn the diagnosis, not necessarily to treat it, but to know
what your limitations are.
What the limitation are, who to refer to,
Yeah.
and that type of thing. So, absolutely. I don't know if you want to go over.
Well, we'll talk about the spinal cord.
Right.
Because, and I know that one time I had this really bad pain in my arm, and it turned out it was up here.
Yeah.
That's the difference, that people start treating something here when in fact that's not where the problem is.
Right. So the spine.
And you can put all the stuff you want on this, and you can take all the
Right. Finding out where the origin.
You got to find out. So it's probably a good idea to maybe check first for the least invasive.
Yes, absolutely. So, conditions like low back pain, sciatica, neck pain, 90+% are not surgical cases. When they're surgical cases, obviously, we have great surgeons to do that. But 90+% are not surgical. So a conservative approach, makes sense, at least in the first stages. So for neck pain, like arm pain, this is showing lower back, but it could be also vertebrae in the neck. And nerves come out of the spine and go down your arm. So if you were to have a pinched nerve.
If that's a cervical disc.
If that's a cervical
disc.
Right, if that's a cervical disc, obviously.
Because there's different ones, the lumbar, the sacral, and all that.
And correspond basically to different areas, absolutely. So if there's a pinched area there or in the low back, could send pain down the leg.
So all your pain and nerves come out of your spinal cord.
Absolutely.
Period.
Yeah, that's it. Yeah, that's absolutely. That controls everything, the central nervous system. Spinal cord is running down the back here. The spinal nerves come out, and this is basically showing a spinal segment, which is 2 vertebrae and a disc in between.
And that's what gets ruptured sometimes.
Absolutely. So what we're showing here is, disc is a nice, some people say like a jelly donut. The outside is like a tough kind of fibrous tissue. Inside is kind of soft. So here we're showing, obviously it's not soft here for the model, but this would be showing a herniated disc. Kind of looks like a gummy worm a little bit. But if it puts pressure on a nerve, that could correspond to arm pain, leg pain, that type of thing. And treatment, conservative treatment, for the most part, we can try to avoid surgical intervention. Not always, but sometimes.
And usually it's relieving the pressure on those. Now, actually, what they brought up there is a pretty good illustration of what you just were talking about. Is that correct?
Yeah, absolutely. So that's basically showing the way the nerve travels, basically, and also what it controls. Motor, sensory, that type of thing. So when you have an issue like a herniated disc, it can affect motor and sensory, problems, like a dropped foot. People who have sciatic.
Oh, I had that once.
Absolutely.
Oh, that's really a weird thing to have.
Yeah, because the sciatic nerve.
That was the sciatic nerve.
That sciatic
I had
nerve,
no idea
most
what it
likely.
was, yeah.
I mean, it could be from different things, but the sciatic nerve controls that.
You can't do anything with your when it's
Yeah,
like that.
absolutely. Yeah,
Yeah.
so,
It went away, but it was like scary.
yeah, sometimes they can resolve on their own a little quicker, sometimes with, with treatment.
Yeah.
Absolutely.
Now, I know that we have a slide on the sciatic nerve. A lot of people have sciatica.
Yeah.
Is that the right slide? I can't tell. from
Yeah,
here.
so I'm looking at it to the left, would be showing the sciatic.
It'll be on the right is what's actually going out. People can see it.
Right. Oh, okay. So the sciatic nerve, largest nerve in the body, runs from the low back, down the buttock, all the way to the foot, basically branches off, but runs all the way down to the foot. So when people, pretty common condition, can be caused from multiple things. Can be caused from a herniated disc, like we talked about. Can be caused from muscle spasm, trauma, those types of things. So sciatic is kind of sort of a catch-all term.
It is, because you hear, oh, my sciatica is killing me, and I'm going, I wonder what is.
Right, sometimes it's sciatic, sometimes it's not,
Yeah.
but
It's a catch-all
it
term.
is kind of a catch-all, yeah, absolutely.
And how is that treated? Can that be treated with chiropractic?
Yeah, absolutely. Manipulation definitely helps ease the pressure on the sciatic nerve, can help ease the pressure on the sciatic nerve. Exercise, super important.
Well, that's one of the things that I think with chiropractics, and I have gone to you, so
Yeah,
I mean,
absolutely.
this is why we've been talking about this, and I thought it was something we should bring forward. The fact is that there are exercises, once you assess the problem, there are exercises that people can go home and take care of themselves.
Absolutely.
To help alleviate and maybe prevent.
Right, absolutely. I mean, of course, I'm going to say, chiropractic is, and it is, it helps these situations. But honestly, you have to do the exercises. You have to be mobile, good posture. Otherwise, no matter what you do, you're not really going to get anywhere.
Never
yeah,
solve
never,
that.
yeah, never solve the problem. It'll become chronic.
If you find a condition that you feel needs more treatment, what kind of medical treatments, or not treatments, but tests and things can you prescribe to kind of figure out the cause?
Sure. So, X-rays.
I mean, I'm not just you, but any.
No, anybody. Yeah,
And
absolutely.
we're talking in general about chiropractic,
Right,
so.
right, absolutely. So X-rays are, sometimes a good first, step. Can show degeneration, can show bone spurs, that type of thing. For something like a herniated disc, MRI is kind of the gold standard. It's showing soft tissue, so it can show the nerves, it can show the disc. So it shows a little bit more of, it'll show if
So
there's.
you're not working in the blind?
No, exactly, absolutely, right. Definitely gives us a little, it's not, once again, it's not perfect, but it gives us a little more information.
Yeah, now, I noticed that in your resume, you mentioned that you do sports medicine, or not, or I said sports medicine.
Yeah.
Sports chiropractic.
Yeah.
What does that involve? Is that like if you get, what was it, the Tommy John, or is that what,
Well, I
is that
mean,
what it's called?
that's-
Am I making that up?
No, Tommy John is a surgery.
Oh, okay.
I'm
I knew there
a
was
baseball
something to
fan
do
too.
with
So, yeah.
yeah.
But sports injuries with chiropractor, you can train to be like a team chiropractor. That would be.
I'm sure that every sports team has a chiropractor.
Yeah, but the big sports teams definitely do. I'm not a team, chiropractor, but we learn how to deal with, once again, sports injuries, but conservatively.
Like that's if you throw your shoulder out.
Right. Yeah, it could be a rotator cuff, could be tendonitis. The different types of injuries. to
So
deal with.
you can treat tendonitis, or not treat, but you can work with tendonitis.
Yes, the scope
I
of.
want to be careful with saying treating.
No.
Yeah.
The scope, but the scope of chiropractic in New York keeps us generally with the spine unless it can be related to the spine. So if it's something that, like if it's your shoulder because of your neck, we can treat those types of things. Does that make sense?
Yes, it does. If it's a lacerated shoulder, you're not going to treat it.
Exactly. That's definitely not us. We're
Yeah.
well, you wouldn't be
Been in
coming.
an
You wouldn't be
accident.
coming to
Yeah,
us.
yeah.
Absolutely.
Yeah, you're not going to run. Yeah.
No, definitely not. So.
But you can differentiate from those things.
Yeah, and I think that's schooling. I know that I went out in Chicago, National University of Health Sciences. They great at teaching us, like I said, to be able to diagnose and knowing when it's not in our purview, basically.
Yeah,
For the most part, yeah.
Well, I think that, I guess the reason that I invited you, because
Yeah.
a lot of people have questions about that, and they know that you go to your medical doctor for everything, but on the other hand, sometimes even going to a physical therapist or and you do physical therapy as well, I believe.
There's physical therapy modalities that we
Yeah.
use.
Certain
Definitely, I'm
ones
not
that you can do.
Yeah, but yeah, there's like ultrasound treatment
Yeah.
and that type of thing. Yeah.
Exactly.
Yeah.
So there are other methods of treating the body that are non-invasive and don't require medication per se. I mean,
Right.
you can take an aspirin or something like that, but
Right.
but not what I would call the heavy-duty things.
Right.
And so it's just an option.
Absolutely. You know, an
And
option.
I wanted people to know that there are options out there for other types of treatment. And perhaps, you start out with something more simple and then work on if you have to.
Right.
Yeah.
Great.
Frank, it's so glad to have you on the show.
Thank you so much, Ann.
And I think you really explained it, and I love that you brought your little show and tell there.
A little prop.
And show us what a spinal, would that be the size of your,
Yeah,
would that be an actual size?
Yeah, these are pretty, pretty true. I mean, everybody's a little bit different, but these are pretty
I
true.
didn't know
Yeah.
they were that big.
Everybody's a little bit different, but
Okay, that's why my weight, that's why my weight, when I weigh myself, it's because of those, right?
you're fine.
Nothing else, right? Just those lousy bones.
Like 50% at least.
Thank you so much for being here.